Good morning to everyone here. First of all, I would like to thank MPMS to give me an opportunity to share with you all this morning. And the topic that I'm going to talk is the elderly, the challenges we face during the COVID-19 pandemic. We all know that COVID-19 pandemic has been impacting the global population in drastic way since it was first identified in November 2019. Elderly group is facing the most threat and having higher death rate if contract the COVID-19. The reason is because most of the elderly people have pre-existing illness such as cardiovascular disease, hypertension, diabetes, and other chronic or long-term sicknesses. Since the elderly group is vulnerable, they should be treated with respect, dignity, and specially protected during this challenging time. We encourage them to stay socially connected to counter their loneliness, anxiety, and depression. However, it is difficult to practice because most of them do not have easy access to digital platforms such as internet. To fight with COVID-19 is a collective responsibility to protect the elderly people from developing severe forms of COVID-19. Hence, all of us need to work together to break the link of the transmission chain. It is always a challenging task to take care of an elderly person, even before COVID-19 pandemic. Now, let us look at the challenges that the elderly group is facing during this COVID-19 pandemic. First, we talk about wearing masks. In the past, elderly people not used to wear masks. Even we force them to wear masks, they may not wear it properly. Look at the diagram at the right-hand corner. It is commonly happen to our own people. Don't talk about the elderly. This is a problem that we face. Even though we give them the face mask, they are wearing it. Then sometimes they will take it off or wear it in not the proper way. Number two, we encourage them or remind our elderly parents wash hands frequently. However, they don't see the need to do it. When you look at the diagram, wash your hand. When you wash your hand, the proper way, there are 7 steps. Will it be too troublesome for them to practice? Third challenge, social distancing. We ask them to keep a distance, minimum 1 meter, 1.5 meter. They also don't see the need of doing it. Or you remind them, they may have forgotten to practice it. Number 4, now we don't allow them to go out freely as usual and cannot go out and to the high-risk area like hospital, to crowded places like supermarket or the morning market. But morning market and supermarket are places that they like to go in the past. The 5th challenge. Now we don't allow them to meet their old friend at coffee shop for minimum kopi. And this is the common activity that they used to do in the past. Number 6. Now we lock them down at home for the purpose of protecting them from infection. But whether they really understand the need of lockdown at home. Number 7, now we even discourage those family members staying outside or the young kid not to visit them. Now, if your grandparent, your elderly parent did not see those immediate family as usual as before, they may misunderstand that family members no more loving them. The 8th challenge, they may not even fully understand what is COVID-19 pandemic. Now we talk about the MCO, Movement Control Order, CMCO, Conditional Movement Control Order, RMCO, Recovery Movement Control Order, EMCO, Enhanced Movement Control Order. All these abbreviation or all these order, it does not tell them anything, because the whole thing is that we have been locking them down at home. So for the purpose of protecting them from infections. Hence, lock them down at home for long hours will cause them frustrated, feel lonely, anxiety, depressions, and frequent mood swing. What I mean here is that they used to make complaints without reason, or you don't know why they make the complaint. All right. So all this unusual behavior, it really gives everybody stress at home. During times of isolation and quarantine, elderly people need safe access to nutritious food, basic supplies, medicine to support their physical health and social care. Hence, family members must play an active role to support them together during this challenging time. This COVID-19 pandemic has really changed our life, everybody's life, from old norm to a new norm. Now let us settle down and have more quiet time to do a reflection of our own life. First, it forces us to kick out those inconsiderate behavior and those bad hygienic habits, like the photo that you see. Forces us to spend more quality time with our elderly parents under one roof. Now is the time for us to get to know more about the aging problems that they are facing but have been neglected due to our past busy lifestyle. Hence, we strongly encourage whoever currently staying with elderly parents at home relook their quality of life. Please take this golden opportunity to consider the following suggested 11 recommendations. First, learn how to talk to your elderly parent effectively. Don't every time you meet up each other and have a quarrel or have a conflict. And also understand their needs better. Listen to them more. Listen to not only the words, you listen to the heart and the feeling. Number 2, ensure home setting is safe for moving around. That means don't let them have the chance to fall. Now what we can do here is install handrails at fall risk area, use non-skid path mats, use a shower chair with a handheld shower head, install a raised toilet seat frame so that they can do toileting themselves without any assisting. Number 3, prepare for emergency, such as what if your dad or mom fall sick, unable to see a doctor for prescription renewal or take the medicines, that not able to buy food supply in time. Over here, we have made up a recommended keeping list for your reference. First, keep clean drinking water. Keep 3 days supply of non-perishable food. A fresh light and battery in case of blackout. Because whenever blackout, the elderly people will feel very panicked. Number 4, a first aid kit. Number 5, personal protective equipment such as face masks and gloves. Number 6, extra medications. Fourth, if your elderly parent is not able to do the following daily routines such as eating, bathing, dressing, toileting, and the ability to keep moving around, and if you are not able to cope with your elderly parent at home, please consider to get a competent carer who have the experience to assist their activity of daily living as what I mentioned just now. Fifth, meet the need for companionship. Elderly parents need companion to talk and stay close with them. Otherwise, they feel lonely, anxious, depressed, especially during this CMCO period. Number 6, motivate your elderly parents to stay active. We know that regular exercise helps elderly parents to maintain the strength of their bones, joints, and muscles, reduce fall risk, reduce memory problems, reduce depression, and prevent dementia and mental decline. Since they can't go out as freely as before, we can download video clip from internet and do the exercise and activity with them together, like the photo here. You see they are so happy to do things together. The list is here. We can download the online exercise classes, but make sure the exercise that is suitable for the elderly, not for the young adult. You can download YouTube dance video, same thing, download those suitable for the elderly movement. Connect with grandchildren via video chat for a game. Do video call with outstation family member through WhatsApp. Nowadays, WhatsApp is a very powerful communication tool. Please utilize it. Number 7, avoid scams. Unfortunately, seniors are often the target of financial scam. This scam will often prey on the seniors' fear and insecurities. So we need to educate elderly parents the following common scams, such as, first of the list, medical or health insurance scams, false health claims, anti-aging product. You can see the first 3, they are related to health issue. Then you come with telemarketing or phone scam, internet fraud. These 2 are talk about communication. Number 6, we have investment scheme, homeowner and reverse mortgage scam, lottery scam. These 3 are related to financial issue. A loved one needing help scam. So what we can do here is always remind them, never disclose personal information such as IC number, bank account, or credit card number to any outsider who call in by phone. Number 8, recommendation. Set up your neighbor home watch system. Those members include your family, close friends, and neighbors. In case something happened to your elderly parent, at that time nobody at home, then someone can come in to your house or his house immediately and give prompt response. Always keep emergency and important contact numbers such as 999, to link to police, ambulance, and bomba. And also your number next to the telephone set so that your father, your mother can access the number easily. Number 9, visit to hospital. If elderly parents are not fit to go to hospital for regular review, we can take a video clip on their latest condition and show it to doctor for review and diagnosis. Number 10, sharing accurate information to them so that elderly people have clear knowledge to remove their fears, learn to stay physically and mentally healthy during the pandemic. Number 11, the last recommendation that I have, always remind them to practice the new norm and COVID-19 standard operating procedure. You look at your right-hand side. When you practice SOP, you not only protect yourself, you also protect others. This is the end of my talk here. If you have any question, please post your question to the chat side. We will pick up your question after the talk or open dialogue. Thank you for your attention. This is my number, contact number. You can contact me if you have any question after the talk. Thank you for your attention.